So, Schilling Test. Normal pathway, you get your loading IM injection of B12, that's a non-radioactive form. Then you swallow a radioactive B12 form. Swallow, come down to your ileum. You should have intrinsic factor that should absorb this. And your B12, bring it down. So your radioactive B12 with your intrinsic factor should go into your bloodstream, into your kidneys, and the excess should be extruded in your urine. But things happen, so abnormal way. Radioactive B12 loading IM, B12, no intrinsic factor. What are you gonna do? Nothing in the kidneys extruded, no binding. So we go on to phase 2. Phase 2, you get your radioactive B12 and they give you intrinsic factor also. And you get your loading IM dose of B12. So you got both of these and one of these coming down. So say normal pathway should happen is the binding and excretion. So if you get your normal binding, then it should be here extruded in the kidney. So that's percutaneous anemia. So basically it implies a decreased intrinsic factor was the cause of the B12 deficiency. So when they gave you the intrinsic factor with your B12, it worked. Well, up here you don't have an intrinsic factor, so that's why we went on here to see maybe it was intrinsic factor that you were missing. But say nothing got absorbed, even if they gave you intrinsic factor. So what that implies is it implies terminal ileum disease was the cause of B12 deficiency. So the cause could be like Crohn's disease or some type of inflammation in your stomach. So that's a Schilling test from what I learned, and pretty much that's it.